We had a great project with you. Can you share about the campaign and also what you thought worked about it, where the successes were, and where the challenges were?
So what the campaign did effectively was to take a really carefully crafted message that was designed to provide really clear, helpful information about not only what the opportunity was here with regard to health insurance, but also how people could actually access that health insurance, what the next steps would be for them. And we brought that message in a couple of different formats. And so we worked through both advertising in the transit system, as well as advertising through ethnic and community newspapers. And so we worked with a number of our partners in the media to get that information into people's hands. The other one that we really know that people use, especially young people, is social media and our website. And I think in both cases, both social media and our website, we saw a really incredible response.
So is there any way to tell exactly how many people may have benefited from this advertising campaign, or any numbers that you can point to?
So the way that we've measured the effectiveness in reaching people who might be interested in gaining DACA status and then getting health insurance has been to look at the number of people who applied for DACA, both before the campaign and then looking at what the effect of the campaign was on those application numbers. And what we saw really is that the period just before the campaign launched in 2015, early 2016, was actually the lowest number of DACA applications filed since the launch of the program in 2012. For various reasons, it may have been that people had begun to lose interest in the program, that people had ceased to be aware that the hardest to reach population may have needed additional effort to reach them. And then what we saw from the period during the campaign's launch, and then also the period just following the campaign, we saw the highest numbers of DACA applications filed statewide really since 2013, since the very early days of DACA when the numbers were so high. So we were really encouraged, and we think the really dramatic increase in DACA applications that we saw really we think is traceable to the efforts that this campaign made to reach young adults and to really educate them about their options.
So it went from the lowest number of DACA applications in New York State to a big jump. How big was that jump?
So the jump that we saw from the period just before the campaign to the period just after the campaign was really an incredible jump. It went up by a factor of 5. So a 5 times increase in the number of individuals who were applying for DACA in New York State.